I assume that if you're researching a topic like this, you have someone you know or a loved one is on a ventilator due to COVID. And I just want to take a moment to say that I'm sorry to hear that and that I wish you the very best. The point of this video is that we're going to discuss why COVID patients land on ventilators, what are the pros, what are the cons, and what does that really mean for their outcome. So why do COVID patients land on ventilators? Initially, when the pandemic started, it's a whole new virus. We didn't know what we were doing in terms of doctors, nurses, paramedics, because it's novel virus where it's all new to us. Initially put a lot of people on ventilators. Their blood tests and their vital signs all screamed to us that they needed to be put on a ventilator because of how bad the situation looked. So a lot of people were put on ventilators. You may remember that the news in New York where they were saying we're running out of ventilators, we need more ventilators.
People coming into hospitals who need ventilators, if that rate continues, in our stockpile we have about 6 days.
So we've actually learned now that putting patients who have COVID on a ventilator is not the best thing for them. If you have to, at the very end, once you're not gaining control of the disease and it progresses worse, which can happen to anyone, then you have to put them on a ventilator. But the first thing we do nowadays is not put them on a ventilator, because we used to do that and it wasn't beneficial. A ventilator is used so that we can control their breathing, so that we can help them have less pain, have less discomfort, especially if they've been breathing for a long time and they've been struggling to breathe for a long time. That makes you very tired. And so if a patient is very tired and they are failing Cpap, so there's a good chance that this person who you're thinking about who has COVID went onto a mask or something like that to help them breathe better. If that fails, meaning like they become too fatigued or they're too unwell to breathe by themselves, then they will be placed on a ventilator and put to sleep. A ventilator is good, but a ventilator also has its problems. So the problems with a ventilator is that the longer you're on it, the harder it is to come off, and the longer you're on it, the more likelihood of you getting a ventilated assisted pneumonia. So that means that the longer you're on a ventilator, the more likely you are to get pneumonia. Because you're now asleep and there's this pipe in your throat, you can't manage your airway. So if you vomit a little bit or if you can't swallow your spit, then that stuff can get into your lungs and then you get a pneumonia. So there's many ways to avoid this. At the end of the day, it's almost unavoidable, especially over like long periods of time on ventilators. What are the odds of this person making it? So I've looked at the research, I've looked at some trials where they've studied a lot of patients through the last a year or so, and they're saying that you have about a 25% chance of not making it off a ventilator. So 1 in 4 patients don't make it off a ventilator. Obviously today we have all sorts of other medications and we have vaccines, so these numbers are not always true for today, but they have been for the last while. I hope that this is helpful. I hope this has helped solve a problem, or at least informed you of what is actually going on. I wish you the best. Stay safe and stay well. Bye for now.